Hey, welcome everybody. We're here with Kara today, right?
That's right.
And want to tell everybody where you're from?
I am from the Rocky Mountains in southern Alberta in Canada.
Well, welcome here.
Thank you.
So today we're going to be doing the ankle and knee areas, which we call Cankles, and the knee area up here, which I refer to as the knee complex. So basically everything from her ankles all the way up to mid-leg. Okay, and this is a very common problem that we treat here. And why don't you tell them, what you're expecting and why this bothers you so much?
I have 2 young girls and I don't feel comfortable wearing shorts or skirts. And I don't want them to ever see that. I want to create a nice environment where they feel comfortable with their body. So I would like to be comfortable with my body. So I've got to make changes, and diet and exercise don't work for this area. So I did loads of research. This has been about 1.5 years in the making, getting not just the courage, but finding the right surgeon. We found the right surgeon. So what I'm expecting is to get rid of some ugly fat pockets that are uncomfortable, not painful, just uncomfortable and very unsightly, and things that make me not like them.
Good. And they're not painful to you?
100% not painful.
Okay. So as you can see, Kara is very thin up top, and the areas down the legs oftentimes don't match the thinner upper body on a lot of the patients that we treat. This is pretty common because the fat down in the lower leg and ankle area seems not to be as metabolically active. So when you do exercise, lose weight and such, it just doesn't go from there, right?
Absolutely not.
And typically this is an area that's bothered, from the patient experience I've had, it's bothered them most of their lives, and they just haven't had any way of addressing or making it go away, right?
Absolutely.
And it's pretty significant problem when you can't wear clothes that that you want to, and it does affect people in a pretty significant way, confidence-wise, right? So yeah, so today it's all going to be on.
Let's do it.
You ready?
I am. I'm nervous, but I'm ready.
Okay. There. She's thin, tiny up top, and then we have leg areas that are thicker, and really we're talking about the lower part of the legs that are a lot thicker. And I was explaining to her earlier, as we're looking at everything, the area around the knees is so important, because when you look at the entire leg, if the area around the knee is thicker, it kind of it doesn't work well proportionally. You want the knee area to be as thin as possible. So we treat all the way up to about mid-thigh to start the tapering process, to bring the knees as thin as possible. You can kind of see the markings in there. But in any case, when we take away that bulky area around the knee, the total legs will look a lot slimmer. And then, of course, the area that bothers so many patients is this area around the ankle where it flares out a little bit. And she has just a little early cuffing, not a lot, but we're going to see a very nice slimmer shape later. Can you turn around, Kara? Okay. And so we can see in the back, some of the thicknesses. And as I was explaining to her earlier, right now her lower leg just looks kind of large, not defined. Do you mind going up on your tippy toes? Perfect. So we can see a little bit of the edge of the calf muscle. Look, come back down. We don't, as she's just standing there, we can't really see the calf muscle much, but it's only because it's covered in fat. When I remove all that fat, immediately after we're done, we're going to see some nicely shaped calf muscles, and it's going to look a lot more tone. You can turn around. So we're going to get started now, and we'll see you guys in a little bit, okay? Hey, Kara.
Hi.
Hi, how you doing?
Good.
You eager to see what everything looks like?
I'm super excited.
Okay, can you get the pads right over here? Okay, when we stand you up, you're going to stay on the pads, okay? And if you feel lightheaded, just let us know, okay?
Okay, I'm not going to open my eyes till you tell me it's
okay.
okay.
No, come on over here. Yeah, go guys, come on over. How's everything been so far?
Good.
Okay, well, here we go.
Am I allowed to look?
Yeah.
Holy crap. I think I might cry.
You think so?
Oh. Holy freaking Lord, shut up. Holy shit. Sorry. Mother of Jeebus.
Shut up. No way, that's cray-cray! Oh
So
my
you got some
gosh.
really toned calves, right?
Shush! Oh my gosh, look at my knees!
Yeah. See how everything slenderizes down?
This is cray-cray.
Okay. So your whole legs look better now, right?
They don't even look like my legs!
And matches the rest of your body now.
Holy bejeebus.
If you want to turn around, you can go up on your tippy toes, and you do have a very, you know, I told you you have very strong muscle. Look at, you know, your calf
Oh my
muscle.
gosh.
Very developed there.
Shut up. I have an ankle bone? What?
Yeah.
My Achilles?
Yep.
My knee. It's like half the size.
Yeah. So now you can see the definition of the muscular system.
Scheiße.
Okay. Cool.
Yeah.
How was it so far, man? As far as tolerability?
Oh, maybe a 2 out of 10 on comfortability.
Okay.
Yeah.
And you were so worried, right?
I was so worried.
You
I
were
was
so
shaking.
worried that it's going to be bad. Okay. Awesome. Okay. We'll come back later. Take care. You ready to take a look at the final results?
I am.
Okay. Let's get up here and careful.
Thank you.
Bring your weight right on over.
Can't believe it's done.
Well, I think it is, unless we see something here. Okay, let's take
It's so bizarre. Those are my legs. Wow.
Nice.
It's so surreal. It's so surreal.
Okay, you grab my arm or something. Take
Yes.
it around. Yeah, that's nice.
Like, it's so surreal.
Okay, awesome. Let me just take a peek up here. Yeah, I think it's done.
So
You see
surreal.
anything that
No. I honestly do not.
looks nice, looks complete, looks smooth? All right,
Wow.
good deal. Is that what you're hoping to see?
It's obviously what I was anticipating, but it's so much better than what I expected.
Okay.
So much better.
Awesome. All right, let's say goodbye.
Thank you.
Bye-bye.